Thank you for staying with the Monday Report. You're still here with Peterson Wachira, who's the chairperson, Kenya Union of Clinical Officers. And Peterson, I was just looking at some of the demands by the clinical officers. You want an enhanced risk allowance of 15,000 shillings. You want the ministry to recruit over 20,000 unemployed and qualified clinical officers. You want the employers to also immediately issue letters of confirmation to permanent and pensionable positions for UHC staff, COVID-19 employees, UHC interns, national TB program. You also want the interns to be paid. Are these practical demands considering there's a constrained fiscal space?
Trevor, in 2021, we had a strike during the COVID-19 period. This strike was informed by the fact that the health workers were facing an increased risk, and that by then we were not provided with the requisite and appropriate protective gear. So there was a multi-departmental team that sat down that was actually chaired by the CS Labour. By then it was CS Chelugui.
Yeah.
And this is where this was negotiated. So this is not something new that we're actually negotiating. This is an agreement we had in 2021 with the Ministry of Health. So it's basically about implementation. But now coming to employment of health workers, in the plan of this government, they opine that in the coming years we are supposed to get to a point where we move from the universal health coverage to universal health care. That means that other than ensuring that every Kenyan has access to health, we want to look at what is the quality of health that they are getting. Now, the quality of health is not about the infrastructure, is not about the machines, it's about the health worker. That health worker, there are several things that they must have. One, you must get somebody who is well qualified and with the requisite experience to be able to see this patient and make the right diagnosis. For them to do this, they must then go through an internship period of 1 year. And clinical officers have been going through internship since 1928. It is not something that started the other day. Now, the internship in the health sector is different from the other internships. In fact, it's called indentured learnership or apprenticeship. And the difference is in that this is a qualified person, they graduated, they have a certificate. Mm-hmm. The only reason we subject them to an internship period before the licensure is because they are dealing with a human being. Yeah. You cannot go and experiment with people. So we want to link you to a consultant, to an experienced clinician, yeah, so that after 1 year, when we let you go and see patients on your own, then you are safe hands. When we are talking about now employment of more of this, yeah, you have heard the cry from Kenyans that when I go to that hospital, I have to wait for extended number of hours. Some of them come to hospital at 8, they leave at 4. Some of them will give up, go home, come tomorrow, and probably they were bringing a kid. And then these children will come with complications. Yeah. And you know, people do not understand actually what we mean by this. Let me just give you one example, a practical example. If let's say just a sore throat is not managed well and managed on time, to some of them, it can actually complicate to something we call rheumatic fever. Some of them, when they suffer this condition, if this was not seen on time, yeah, and especially for girls, they'll have heart conditions. Some of them only realized when they become pregnant when they're adults, and some of them actually succumb to that. But a normal Kenyan will not be able to realize this, yeah, because they may not be able to link. But as health workers and people who must advocate for the health of Kenyans, we must be able to look beyond the daily activities, appearing in that hospital and doing what I can with the small resources I have, yeah, to ensure that we have the requisite numbers, okay, so that people do not have to have long waiting times. Yeah. They do not also suffer from misdiagnosis, yeah, because medical errors are sometimes brought by fatigue because we are too few.
Fair point, but yes, can't these demands be staggered so that they're not, in your wording, it's immediate? Yes. Can't they be staggered? So, for example, can the 20,000 clinical officers be employed fast as you wait for your enhanced risk allowance? Why do they all have to be done at the same time? You want the interns paid at the same time, 15,000 risk allowance at the same time, 20,000 clinical officers employed at the same time. But we know there's a calendar budget. Why can't they be staffed?
Trevor, you know what we are saying is not news. We are not here to inform the government for the first time. This is something that we discussed with the president when he was campaigning. It is something that is within the plan. It is something we were expecting to actually see within 100 days of coming into power. And so that is why it is something that we are actually saying that it should actually happen a long time before. Okay. What we are supposed to be talking about this time is how many officers do we engage every year, so that we can be able to reach that point when we have adequate staffing, okay, and Kenyans can actually be seen. Okay. And the other thing, Trevor, is that we have gone through the process of the law that has been laid down by the law, and we have actually exhausted. We have been left with no other option. And the reason we are saying it's immediate is because we also care about our patients. We know there are HIV clinics that they cannot be able to pick their medications. There are TB clinics. They are run actually by clinic officers, and the HIV. They cannot be able to access these services. So the reason as to why we are saying immediate is because, number one, they are doable, because it's either we have an agreement or the court has directed, and so that we can finish faster and go back and serve Kenyans, because that is what we want to do. Number
8 and 10, that the county government of Kirinyaga reinstates all the dismissed clinical officers as ordered by PAC, and that the counties with withheld salaries for clinical officers to settle the payments with immediate effect. Why are county-specific issues a national crisis? This is Kirinyaga based. Why don't you deal with Kirinyaga on its own? It's part of the national crisis.
You see, this is just but a part of the demands that we have. And of course, we are going to address with the specific counties. But I think the point that must come out is the impunity. Because like in the Kirinyaga issue, health workers were dismissed, all of them, doctors to nurses to, I think, morticians. And the Public Service Commission, which by law, according to the County Governments Act, when you are grieved about a decision of a county public service board, like in the case of Kirinyaga, you appeal to the Public Service Commission, and the directive they give is binding. They give the directive to reinstate the 47 clinic officers, and the Kirinyaga government, the Kirinyaga County Public Service Board, actually ignored this. When it comes to the other counties that were supposed to have paid the arrears for the months they never paid during the strike of 2021, we also have orders from court directing them that they should pay these allowances. So, and you know, Trevor, you might now see them tomorrow run to the same court, and I'll be surprised if the court is also going to give them these orders to get us back to work. You'll see them running to the same court where they ignored the orders, going to try and get the orders now to get us back to work. Yeah. But the moment we get back to work, because what they are doing is an abuse of the courts, then they will not appear on the table, because their problem will have been resolved. So if they obeyed the court in the first instance, we would actually not be here.
Okay. Yes. So what are you discussing tomorrow? What did you discuss today, and what are you discussing tomorrow, so that it's progressive?
Yeah, so today we met with the team of the ministry under the which was under the leadership of the PS Muthoni. And as I said again, I think we must give it to the ministry and especially to the PS, because she's really trying. But of course, we know the SRC has its own issues. And tomorrow we are going back to look at these issues. We have tried to segregate them. I will not go into the details, of course, of whatever is going on now, because it's something that we have agreed not to share out, and it's not good to share out. But I can say that probably we are on the right track.
Are you seeing light at the end of the tunnel? So this might end sooner?
Yeah, we have started. Okay. But we can tell that there is goodwill, but we know there are players outside the ministry. There is SRC, there is the Treasury that must be engaged. And what we can hope is that they are going to have the same goodwill that we are seeing, so that these matters we can get over with. For us as clinic officers, If we can finish these issues tomorrow, the better. Okay. Because we want to be back, we want to go there and see our patients. That is what we want to do. Trevor, we didn't go back to school to go into those stressful hours of the night, trying to get medicine into our system so that we can leave patients suffering there. Okay. And we are very uncomfortable when we are out there and we are not seeing our patients because, of course, we feel bad. They are our parents, they are our sisters, they are our brothers. It is ourselves because we are consumers of the same service that we actually offer.
Based on your analysis, how widespread was the strike today? Would you say 90%, 70%, or that those who are still working?
I would say around 95%. And yesterday we said that we are magnanimous enough. We have allowed the level 6 facilities, MTRH, KNH, Odaya, and the level 6 facilities to actually continue for the critical care. But we also said that if we don't see goodwill by the weekend, then we will have to withdraw. But we really don't want to do that. Okay. Yes.
All right, so your final word to the people watching today, is this going to end soon, considering that this
I think my final word, please allow me to first address Kenyans and then address the leadership of this country. Let me say to Kenyans that you have a responsibility. Under the Constitution and Article 43, you have a right to access health services. You must hold your leaders to account. You must ask them what is happening so that they must be able to address. And we are not the problem. We have demonstrated enough that we have the goodwill, but the problem is on the side of the government. To the leadership of this nation, and I want to appeal to the president because we were with him. We were with the president when he was campaigning to become the president. And there are things we agreed. And one of the things we agreed was that the issues of collective bargaining, we were going to ensure that we finish on time, that the issue of perennial strikes also comes to an end. We still hold to that agreement, and it is our expectation as health workers that this will be the final strike that we have because we are going to get an agreement.
All right. Thank you so much for making time this evening. Peterson Wachira, Chairperson, Kenya Union of Clinical Officers. We stand by to hear the results of the meeting that you will have again tomorrow.